Hi, my name is Dr. Rose Khavari. Welcome to this video on everything you wanted to know about augmentation cystoplasty. Sometimes the bladder, especially in neurogenic patient population, becomes small and contracted. It's not able to hold enough urine. So what happens is that the urine gets pushed up to the kidneys and can damage the kidneys, or it can get pushed out. It can cause incontinence and leakage. In those circumstances, when the medications fail, when Botox injections fail, we actually have to make the bladder bigger, and that's called augmentation cystoplasty. In some circumstances, not only we have to make the bladder bigger, we also have to create a channel, some people call it Mitrofanoff, or appendicovesicostomy. We have to create a channel so patients can drain their bladder more comfortably. Now, what are those individuals that actually need these procedures? As I mentioned, most of these patients are either neurogenic bladder patients. So imagine an individual that's in a wheelchair and they do need to self-catheterize. Either their bladder has gotten small and contracted over the years, and that's when we would use their own bowel. Depending on the patient's anatomy, we would use different parts of their bowel and different size of their bowel, and we would reconfigure it and open the bladder and put this big piece of bowel on top of it to make it larger. So instead of needing to use the restroom every 2 hours, every hour, they can actually sleep through the night. They can hold urine for 500, 600 cc's. They can hold it for 5 hours, 6 hours without having any accidents. Now, some of those individuals are comfortable and fine with draining their bladder using a small little catheter called self-catheterization from their native urethra, from below. Some individuals, that becomes a challenge over time, especially the individuals that actually need to transfer themselves from their wheelchair to the bed. And sometimes that's not feasible. You're in public, the bathrooms are not large enough. You may not have the support or the help to be transferred to self-catheterize. So if they want to be more independent, they want to be out of their house and more functional and be able to self-catheterize in their wheelchair, that's when we would actually use another piece of bowel, or sometimes appendix if the appendix is available, and we'll create like a little chimney. We'll attach one end of it to the bladder, the other end of it either to the belly button or to a side of their abdomen, wherever it reaches, and then they can catheterize easily through that channel to drain their bladder. They don't even have to get out of their wheelchair. You can literally just use an empty Coke bottle or bottle of water and put the end of the catheter there and drain it, and that's it. So it brings a lot of independence. It brings a lot of comfort for our patients with neurogenic bladder who are in wheelchair. So what are the approaches to doing this bladder reconstruction, either augmentation cystoplasty or Mitrofanoff, or creating a continent channel? At Houston Methodist Hospital, we've been doing this for decades, so we are sort of the center of excellence in Houston. We can do this in an open fashion, which is a standard fashion, or we have been utilizing minimally invasive surgery with robotic and laparoscopic surgery in selected patients to be able to provide them a faster recovery if possible. Either way, either doing it in an open way or minimal invasive way, you will get the result that you need. It's our job to have a conversation and a very thorough evaluation of every patient's bladder, because this is a therapy that really needs to be individualized. It really needs to be tailored to the needs of that individual bladder, their kidney function, and their overall goal over the next 20, 30, 40 years that they're going to live with this bladder. Thank you for watching, and I hope that this video told you everything you wanted to know about augmentation cystoplasty and Mitrofanoff.